Vax. Yeah. Here at Vax, we gave our 50,000th injection yesterday, so we've given 50,848 total doses, 31,443 primaries, 19,405 boosters. Regarding our volunteers, we have 6,446 people on our volunteer registry. They've given a total of 42,771 hours. And the estimated economic impact of those hours is now $1,163,371.20. We have vaccinated 685 volunteers who have reached the 40-hour threshold. As always, choosing volunteers to represent the rest of the group is a challenge every week, but I do have some behind me to recognize this week. I have first Christine McDade, who was nominated by our volunteers. Checks in to see if there's any extra work to be done or anything extra that's needed to make sure that all the shifts are covered. I have Tricia Siegwald, 25 years with the Kentucky Derby Festival and recently retired. So if ever there was someone who knows about volunteers and the enormous amount of work it takes behind the scenes to make these things run smoothly, it's Tricia. So thank you for joining us and as a volunteer here at Vax. I have Fiona Starks, who was nominated by our Zone 1 staff. Last week, Fiona encountered a gentleman with physical conditions. Paperwork. Without hesitation, Fiona asked this, helped him fill out his paperwork with her own hands. So thanks to Fiona for looking out for our patients and their needs. And then I have Josh Stewart, who's a second-year medical student who helps me with a lot of the behind-the-scenes invisible work that's required to make sure that the folks out in they need to give to the patients who are pulling up and making sure our inventory matches the appointments we have and some of the less glamorous work to be done here at Vax. So thank you, Josh. And then we do also like to recognize our employees of the week, and this week we're recognizing our patient advocacy team who helps us ensure that patient concerns and issues are heard and addressed. These ladies have a passion for public service. They put our community first and work to help our most challenged patients get vaccinated. They're dedicated to serving our patients, and they don't hesitate to bring community concerns to leadership to ensure that our leaders know which problems need to be addressed immediately. And thankfully for me, they are determined to get the job done no matter the challenge, and they never give up. So I have three ladies from the patient advocacy team, Stinson and Olivia Rock. Looking forward to next week. We'll be completing the booster doses for our educator population. The rest of the week, we're giving primary shots to adults age 60 and up, primarily drawn from the Norton wait list. On Wednesday, Vax will be transitioning from the Moderna vaccine product to the Pfizer vaccine. This is due to a state allocation change and the fact that we have a very efficient process here that's equipped to deal with the specific challenges inherent to using that Pfizer product that maybe some of our smaller health departments in more rural counties are less able to handle. I do want to emphasize that if you've got a Moderna shot, your Moderna booster is still here for you. We have plenty of boosters available for everyone who receives. Primary shots will be transitioning on Wednesday to be Pfizer. And then finally, all three vaccines, the Pfizer, Moderna, and the Janssen product, are 100% effective at preventing death from COVID, and they all have comparable efficiency at preventing symptomatic and severe infections. So get vaccinated when your turn comes up, because every dose helps save lives and not just yours. So thank you for participating in your vaccine when it's available. took our first delivery of the Janssen product this week. It was 1,500 doses. The state is on a relatively limited supply at this point for the next couple of weeks, but we intend to deploy those 1,500 into transient housing, people experiencing relevant groups who are difficult to reach and to vaccinate. So that's our first target there. We'll go ahead and take questions.
Doctor, would that happen, say, at the Salvation Army or on location?
So the homeless. We are starting with targeted missions through shelters where we've built trust with testing events and others. These events are taking place in partnership with some of our hospital partners from Norton Healthcare and some KNA with some shelters, and working our way outward from there with planning underway to be able to reach the encampments and other areas where the homeless may be found. So yes, the shelters are helping to arrange the events. We are engaging with those boots on the ground stakeholders who interact with the homeless population on a regular basis, and we'll keep going back to them more than once to try and engage as much of that population as we can.
Dr. Harlage, in transitioning into the Pfizer vaccine, are there any other not only just getting the boosters from Moderna for the people who already got it, but maybe scheduling, do people still wait as long for the second booster?